A patient who's unable to get out of bed must use a bedpan for bowel elimination. To help your patient use a bedpan, begin by performing hand hygiene and introducing yourself.
Hello, my name is Becky. I'll be the nurse working with you today.
Provide privacy by closing the door or pulling the bedside curtain. Then identify the patient using 2 identifiers.
Go ahead and verify your name and date of birth.
Stephanie Ladd, September 12, 1969.
Okay, I'll go ahead and get the bedpan for you.
Okay.
Apply gloves and gather your supplies.
I have the bedpan here for you to use.
Okay.
I'm going to go ahead and help you.
Okay.
The first thing I need to do is get you in position.
If the side rail of the bed across from you is down, raise it and adjust the bed to a comfortable working height. Assist the patient into the supine position. Lower the head of the bed flat unless contraindicated. Look for any drains, dressings, IV infusions, or traction. These devices might make it difficult for the patient to help with the procedure, and you'll need to get some assistance. Raise the head of the bed to a 30 to 60 degree angle. Move the bed linens out of the way, but avoid unnecessarily exposing the patient. Ask her to bend her knees and raise her hips. If your patient needs assistance, slide the hand closest to the patient's head, palm up, under the patient's sacrum, and help her lift. As your patient lifts her hips, use your other hand to slip the bedpan under her, with the open rim facing the foot of the bed. If you can't get the pan under the patient's hips, don't force it. If you're using a fracture pan, slip it under the patient when she raises her hips. Make sure the lower end of the bedpan, the deep open end, is facing the foot of the bed. If the bed is equipped with an overhead trapeze, show the patient how to use it to help raise her hips.
Slide it underneath.
Make sure she can easily reach the toilet tissue and instruct her to wipe from front to back to prevent the transmission of bacteria to the urinary tract.
Put that down.
Place the bed in the lowest position, with the side rails up. Instruct the patient to use the call light when she is
Go
finished.
ahead and hit the call light, and I'll come on back.
Okay.
Then remove and dispose of your gloves and perform hand hygiene. Allow the patient privacy and monitor her status.
Miss Ladd, are you all finished?
Yes, I am.
Okay.
Respond promptly when you see the call light. Perform hand hygiene and apply clean gloves. Place the bedside chair within easy reach, draped with a waterproof pad. Move the top linen aside, exposing the patient as little as possible. If the patient is unable to perform her perineal care, assist her with this now. If the patient has cleaned her own perineal area, make sure all contaminated tissues have been discarded in the bedpan. If the patient is mobile, have her flex her knees, shift her weight onto her feet and upper torso, and then lift her buttocks up from the bedpan. At the same time, using the hand that's farther from the patient, place your hand on the side of the bedpan to support it and prevent spillage. Slide your other hand under the patient's sacrum to help lift her. As you do so, remove the bedpan. Place it on the draped bedside chair and place a towel over it. Change the bed linen if it's soiled. Then remove your gloves and return the bed to its lowest position. Allow the patient to perform hand hygiene.
It's a small amount in your hand, and make sure you rub.
Make sure the patient is comfortable and has easy access to the call light. Place drinking water and personal items within her reach, too.
Did you get enough?
I did, thank you.
Additional nursing care is required for patients who are immobile or have restricted mobility who need to use the bedpan. Raise the bed to a working height and lower the head of the bed flat unless contraindicated. Move the top linen so that you can turn him while minimizing his exposure. Lower the side rail and assist the patient in rolling onto his side with his back toward you. With the open rim of the bedpan facing the foot of the bed, Place the pan firmly against the patient's buttocks and push it down toward the mattress. Keep the bedpan centered under the patient with one hand and place your other hand around his far hip. Then ask him to roll back onto the bedpan. Do not force the pan under him. Offer a small pillow or towel behind the lumbar curve of his back to reduce the strain as he sits on the bedpan.
Side rail back up. I'm going to raise your head.
All right.
I'm going to raise your knee as well. Tell me when it's
That's
comfortable.
good.
You need a pillow behind your back or anything?
I'm okay.
Okay.
Cover the patient for warmth. Raise the head of the bed to 30 degrees or to a sitting position that's comfortable, and raise the knee gatch or have the patient bend his knees unless contraindicated. Provide privacy as the patient uses the bedpan. Respond promptly when you see the call light. After performing hand hygiene, apply clean gloves. Move the top linen aside, exposing the patient as little as possible. If the patient is unable to perform his perineal care, assist him with this now. Lower the head of the bed and help the patient roll onto his side, away from you and off the bedpan, as you hold the pan flat and steady. Remove the pan, set it on the draped bedside chair, and place a towel over it. Use several layers of toilet tissue or a disposable washcloth to clean the area for him, moving from the front to back. Discard the tissues or disposable washcloths into the bedpan if no specimen has been ordered and no intake and output measurements are needed. If necessary, place the contaminated tissue or disposable washcloths in the trash receptacle. As part of your follow-up care, note the characteristics of the patient's stool and urine. Collect any specimens ordered. Empty the bedpan into the toilet or receptacle in the utility room. Use the spray attachment on the toilet to rinse the bedpan. Disinfect it according to your agency's policy. Once again, remove your gloves and perform hand hygiene. Document the amount, characteristics, and color of the stool. Also note in the electronic medical record the patient's tolerance to getting on and off the bedpan.